Welcome to Energy and Health. Today, we're going to talk about something that may seem small, but can be very uncomfortable: ringing or noise in the ears, known in medicine as tinnitus. This condition affects many people. For some, it's not exactly a noise, but rather a ringing, buzzing, hissing, or humming sound. It might appear in one ear, in both ears, or even sound different on each side. If you're watching this video, it's likely that you or someone close to you has experienced this issue. Maybe you've already seen a doctor, but it didn't help much. Or maybe you haven't gone yet, hoping it will pass on its own. Let's be honest. The tips we'll share can't guarantee a 100% cure, but in about 80% of cases, they significantly help reduce or even eliminate the ringing, and we truly hope you'll be in that 80%.
Ear hygiene. It may sound too simple, but one of the most common causes of tinnitus is poor ear hygiene. When earwax builds up and isn't cleaned properly, it can block the ear canal and create pressure, resulting in a sensation of ringing or humming. The solution is simple. Have your ears professionally cleaned by a specialist, not with cotton swabs, which can push wax deeper or damage your eardrum. Regular hygiene not only helps prevent tinnitus, but also keeps your ears healthy and hearing clear.
Blood pressure fluctuations. A sudden onset of noise or ringing in your ears can often be linked to changes in blood pressure, both high and low. If you experience tinnitus, check your blood pressure first. When it rises, the increased pressure inside the vessels of the head can cause ringing. When it drops too low, blood flow to the brain and inner ear decreases, producing a similar effect. Maintaining stable blood pressure through proper diet, hydration, and stress control can make a big difference.
Side effects of medications. Certain medications list tinnitus as a side effect. These can include drugs for lowering blood pressure, cholesterol-lowering statins, antibiotics, or even painkillers. Always read the instruction leaflet for your medications carefully. If you find tinnitus listed among the side effects, consult your doctor. You may need to switch to an alternative that's gentler on your hearing system.
Tension in neck muscles. This is one of the most overlooked but very common causes of tinnitus. When the neck muscles, especially the sternocleidomastoid muscle, are tight or overstrained, they can compress the carotid artery, reducing blood flow to the brain. This lack of circulation leads to ringing in the ears, dizziness, or fatigue. The best solution? Do neck relaxation and stretching exercises. You can easily find simple, safe routines online. If you practice them twice a day for 5 to 7 days and notice improvement, continue regularly. Consistency is key to keeping your muscles relaxed and your blood flow healthy.
Stress and emotional strain. Severe stress and emotional exhaustion can intensify or even trigger tinnitus. When you're anxious or under pressure, the brain becomes more sensitive to internal sounds. That's why it's essential to normalize your sleep, breathing, and relaxation routine. Meditation, walks, and deep breathing can all help reduce noise intensity and bring calm back to your nervous system.
Problems with the spine and blood vessels. If tinnitus doesn't go away despite all efforts, the cause might lie not in the ear, but in the neck or blood vessels. Cervical osteochondrosis, or degenerative spine changes, can compress blood vessels that feed the brain. Carotid artery stenosis, narrowing due to atherosclerosis, also reduces brain blood flow. In both cases, besides tinnitus, people often experience dizziness, weakness, or headaches. If you have these symptoms, you should visit a neurologist, neurosurgeon, or vascular specialist and do a Doppler ultrasound of your neck vessels. Inner ear disorders and hormonal imbalance. Tinnitus may also appear due to inflammation of the middle or inner ear or thyroid gland dysfunction, either underactive or overactive thyroid. Hormonal imbalance affects your metabolism and vascular tone, both of which can influence how your ears and brain perceive sound.
Allergic reactions. Surprisingly, even allergies can cause tinnitus. If you suspect this, try taking anti-allergy medication for 3 to 4 days. If the ringing decreases or disappears, you've likely found the cause.
Tinnitus is not a disease, it's a symptom, and like any signal from the body, it shouldn't be ignored. Sometimes it's harmless and temporary, but in other cases it can point to serious issues with circulation, nerves, or hormones. So if none of these natural methods bring relief, don't delay. Visit a specialist for a full diagnosis. Check your spine, blood vessels, thyroid, and ear health. We believe you can be among those 80% of people who regain comfort and silence by following these simple but effective recommendations. Take care of your health. Listen to your body. And may your world always be filled with harmony, not noise. Friends, take care of yourselves and listen to the signals your body sends you. Inner silence isn't just the absence of noise. It's the harmony of your body and soul, when nothing stands in the way of living with energy and joy. If this video was helpful to you, please give it a like, subscribe to Energy and Health, and share it with those who are also searching for their path to wellness. See you in the next video, and may your life be filled only with silence, the music of nature, and a kind heart.